good evening to all our viewers on Bethany TV. My name is Dorothy. Welcome to Health and Wellness, which airs every Saturday from 8 p.m. till 9 p.m. Welcome to the show. Those who have missed me, don't worry, I'm back. It was really a sad moment at home, but now we are back on our feet. Welcome to the show. Today we'll be talking about palliative care in cancer patients. I have two beautiful ladies in the studio that will be here to elaborate more. Why is it important to have palliative care, and how can one acquire palliative care? Why is it important for someone to have palliative care? I do have two beautiful ladies, that is Dr. Joyce Zalwango and Lisa Irumba, all the way from Palliative Care Association of Uganda. Welcome to the show, beautiful ladies.
Thank you so much.
Yeah, so you can maybe reintroduce yourselves. I called you doctor, I called her Lisa, so I don't know which one should I use better.
Thank you so much. My name is Joyce Zarango. I'm not a doctor.
Okay.
Joyce Zarang Mayanja. I work with the Palliative Care Association of Uganda as the Capacity Building Manager.
Okay.
Yeah. And I'm Lisa Irumba. Christine, I'm a palliative care clinician, and I work as the Advocacy and Research Officer at the Palliative Care Association of Uganda.
Welcome to the show.
Thank you.
I believe it's your first time at Bethany TV.
Mm-hmm.
Okay, you're always welcome. The doors are always open. So today we're talking about palliative care, mainly in cancer patients.
Mm-hmm.
I'll start with Lisa. Explain to us the difference between palliative care, or what is palliative care, and how is it different from hospice, because we have heard about it as well.
Mm-hmm. Thank you so much. So palliative care has many definitions. There are standard definitions, but in simple words, it is comfort care that is offered to people that have very serious illnesses. There are standard definitions by the World Health Organization, which defines it as the holistic care that is given to people with life-limiting illnesses after an impeccable assessment has been done. And an impeccable assessment is like a perfect assessment. And the key words are holistic, meaning it's not just physical care. So it is psychosocial care, it is spiritual care, it's emotional care. It's that total package you offer a patient that has been diagnosed or has been told that they have a serious problem. So this care does not just stop at the patient, it extends to the family.
Oh, wow.
So that's in brief what I can say palliative care is. And hospice care is care for persons that have been diagnosed with incurable illnesses. And statistics say that people will receive hospice care if they have, less than 6 months to live. But of course, you can say who determines that a patient has this time. It's definitely God. But for the caring team, once they've been giving different treatment modalities, they are able to tell that this patient is now no longer responding to treatment and that death is likely or is imminent. So that is what I could say hospice care is. So hospice care provides hospice care as the word, but they also provide palliative care, which is care given to anyone that has that serious illness or problem.
All right.
Yes.
So when does one get the palliative care? When does one consider of having palliative care?
So palliative care should be provided to the patient and their family as soon as a diagnosis of an incurable illness is made. Because if you go to hospital today and they tell you that you have a cancer or that you have AIDS or you have diabetes or you have any serious illness, you have a lot of worry, you have a lot of fear, you don't know how to cope, you don't know what will happen for the many months or years you'll be with this problem. So palliative care should be started at that time. However, the amount of care that is provided increases as the disease continues to advance. So if someone walks in and they have a stage 1 cancer, the palliative care we're focusing on today is for cancer. you will give palliative care. You'll tell them, you know, there are these different treatment modalities that you can get and that you can get better. You can cure from your disease, or your disease will continue to progress, but there are treatments that you can receive to help with a problem, and that there are people that will talk to you, speak to your soul to enable you and your family cope with this problem. There's someone that will hold your hand and walk this journey with you, and that you're not alone.
The dying journey. But for someone out there who would want to understand in lay language, mulumi oluganda mulufut, I think I will ask Madam Zalwangu to explain for us in Luganda. Palliative care chechi chiyamba omuntu agenda mu palliative care nakuraki omuntu abalina okugenda ofuna obuyambi obwo.
Kale webale nnyo Dorothy. So mu lulimi olwaffe olunnansi, palliative care bwe bujjanjabi obuweebwa omuntu yenna ayina endwadde ez'olukonvuba oba ngamba endwadde ezitagenda kuwona nkya, okugeza nga kookolo, abamu gwe bayita kansa gwe twogerako olwaleero, nga nalubiri abamu gwe tumanyi nga sickle cell, nga endwadde ez'omutima, endwadde eza sukaali. Kati kuno mu palliative care kubudaabuda okw'omuggundu ng'ogezaako okulaba nti omuntu ono n'ab'omu maka ge obulamu bwabwe yadde nga bayita mu kino eky'endwadde etagenda kuwona nkya babeera bulungi, ng'ojjanjaba omubiri okugeza ng'obulumi n'ebirala ebiba bizze ku bulwadde obwo, ojjanjaba omwoyo gwe kubanga abasinga weesanga nti bw'afuna endwadde eno tekyamuganya nagendako mu kkanisa. Ekyo ne kibeera nga bwe bulumi bw'ayina n'okusinga obulwadde bw'ayina. Tujjanjaba ebya bulijjo awaka kye twandiyise social. So palliative care naye ezingiramu ekyo nti olero omukyala bw'afuna kansa w'omumwa gwa nnabaana kireetawo obutabanguko mu maka, omwami takyamufuna. Kati ebyo byonna palliative care ebizingazinga wamu okusobola okulaba nti budaabuda omulwadde wamu n'ab'omu maka ge okuviira ddala lwe bakuzuulamu ekirwadde kino okutuusa ddala lw'ova mu nsi. Nzirayo kali nti palliative care kufa. Palliative care tekitegeeza kufa. Palliative care kitegeeza nti omuntu afuna okubudaabudibwa kuno kwe yeetaaga okusigala ng'akola ebyo ebintu bye yandibadde akola singa abadde mulamu, ate era n'okutuusa nti bw'atuuka okuwummula awummula nga talina bulumi oba ng'ateeseteese n'ab'ennyumba ye.
Kati ssaawa ki oba budde ki omuntu bw'alina okugendera okufuna obwo obuyambi bwa palliative care?
Obuyambi bwa palliative care kasita bakeera ku makya ne bagamba nti tukuzuddemu kookolo, palliative care atandikira awo. Lwaki? Nti omuntu yenna kati nga nze Joyce leero bw'okeera n'ogamba oyina kansa wa nnabaana, ekisooka okuddako kubagamba ŋŋenda kufa Dorothy, ŋŋenda kufa, bwe mmala ogamba ŋŋenda kufa abaana bange mbaleseewa, n'otunuulira omwami wange. Kati palliative care etandikirawo we bakugambira nti ekirwadde kino weekiri. Okubudaabuda okwo ne kubeera kwa mitendera, kuba we bakugambira nti tukuzuddemu kansa oyinza n'okuba gwe weetutte mu ddwaliro, naye kati awo ne batandika okubudaabuda okulaba nti osobodde otya okufuna obujjanjabi, osobodde otya okutegeeza ab'omu maka go, osobodde otya ogenda ku ddwaliro. Abamu babazuulamu endwadde nga n'eddwaliro tamanyi gye liri. Palliative care atandikira awo paka n'amaliriza. Kati ye takoma mu kkubo nga ogaa nti ngenze ne bankuba empiso kiwedde, omusawo tafuddeeyo kumanya, omusawo akulondoola okutuusa obulamu we bukoma.
Kale katwogedde ku palliative care, we are specifically talking about cancer, but you have mentioned some of the diseases that usually undergo palliative care. You can elaborate more of the diseases omuntu zasobola okutandika okunotinga down that we bazikebera ne basanga muntu tatandika okutya, okuba amasimu, okutiisa family agenda kufa. Bulwadde ekyo omuntu bwalina okubeera nga is aware of that anytime I need this palliative care so that my family is comfortable and not scared.
Okay, thank you so much. So when we come, who needs palliative care? What are those conditions? So we look at a number of them, cancer being number one because it's a big scare in our country and the world as well. But we look at most of the non-communicable diseases. You realize COVID-19 palliative care was needed.
Very true.
Reason being, there was a lot of fear, there was a lot of death. So you had to address the physical by getting treatment to this patient, the psychological, the social, and the spiritual. So patients with cancer need palliative care. Patients with cardiovascular disease, they need palliative care. I've been to hospital, I've seen patients with kidney disease suffering a lot, thinking, are we going to go back home tomorrow? Which may not be the case. So they also need palliative care. We have children, I'll say children, though even we have adults with sickle cell.
Sure.
There is a lot of pain that comes with sickle cell. They need palliative care, that reassurance that they can be able to do other things, but most importantly, having their pain controlled to enable them continue with their activities of daily living.
Okay.
So a number of them need palliative care. I'll say life-limiting illnesses, mental health, we need palliative care. And this is a time where we see our people are not dying like we used before. Our life expectancy is coming to 65.
Yes.
So, but we know we have people that have lived even more than that.
Very true.
So those are older persons that need palliative care because their kind of problems will not go away tomorrow with a tablet or an injection, but continuous following up with them.
Wow, that's beautiful. Thank you so much. Now I wanted you to explain more like the role of palliative care team and who typically comprises of it.
Okay.
Bani ababeerayo basawo bokka ddagala lyokka bitanda byokka.
So the role of the palliative care team is for all of us.
Okay.
I'll say that will be my opening statement here. The community has a role to play, but when we come to the treatment and care side, we need the nurses, we need the doctors, we need the social workers, we need the spiritual leaders, we need the lawyers. So you find that nurses and doctors will do their work to treat the body, to manage the pain and symptoms. We'll need the spiritual leaders to help with the spirituality of this patient and their family. Then we'll need the lawyers. There is a lot of land grabbing. After knowing she has a cancer, she's dying, so you find those problems. So we've seen ourselves bringing in the paralegals into this to see how they can support the patients and their families. We need the policy makers. Uganda has no palliative care policy, but it's looking forward to a palliative care strategy that calls for policy makers to advocate for a budget allocation for palliative care medicines to be available, for health facilities and infrastructures to be in place. Policy makers, media, Dorothy, you're playing a very good part. Yes, like giving out the information to the people about palliative care. So it is a collective effort all together, but having a core team of the health workers, social workers, counselors, and spiritual leaders working with us.
Wow, thank you so much. Well, if you've just joined us, this is Bethany TV for Health, that is our slogan, and today we're discussing about palliative care, mainly in cancer patients. Beautiful ladies are here, Madam Lisa Irumba and Joyce Zalwango, who are here to explain more and more about palliative care. Now, specifically, you're talking about cancer patients. What are those signs and symptoms that you discover? Does a patient come, they're already active, already cancer patients? Because we say when someone has already discovered that they have cancer, mumuwe ddagala, or it's only counseling and yes. What mainly do you do when someone, apart from, because you've said we need spiritual leaders, doctors, so palliative care has a whole package. That's what you're trying to say. But for mainly cancer patients that are already sick, would they chabwe mbagalira? Because all of abajanga already bawedde you stage cancer 4. What do you do?
So the goal of palliative care is to improve the quality of life of the person that has the problem. And so if a person presents in hospital and the person has cancer, be it a young child or an old person,
yes,
most of the time that there are those problems that will have happened in their life. Most of the time it's pain.
Oh, yeah.
Depending on which area the cancer is affecting.
Yes.
So palliative care looks at pain and other problems. So we manage the pain. And the gold standard for managing moderate to severe pain globally or worldwide is use of oral morphine, which is an opioid or a class A drug.
Okay.
And in Uganda, we are lucky that we have this medicine available. It is free of charge. It's not to be paid for by any cancer patient. And this morphine is reconstituted at Hospice Africa Uganda, and it is supplied to government entities through the national medical stores and private facilities through the joint medical stores. So when we look at pain, you know, they'll manage the moderate, the mild, the overwhelming pain that is in the body. But the person might have other problems. They might have nausea. They might be vomiting because of the treatments that they are getting, but also because of the chemicals in the body.
Sure, because they have side effects as well.
Absolutely. So then you manage the sickness. So really you manage the pain and any other problems.
Oh, wow. But mainly is pain.
Yeah. So those are the physical things. But the patient might have worry, they might be anxious, they might be scared, they might be sad. So if that problem escalates, it will still be managed by the appropriate medicines.
Very true.
Yeah. And of course, what my colleague Joyce was saying, if their other pain is escalated by other psychosocial issues, the social worker will play a role. You know, is it the children are out of school? Is it a property issue that they need some legal support?
Yes.
So you address that psychosocial pain. If it's spiritual pain, a person has lost meaning in life. Why me? Why do I have this problem? So if they have spiritual pain, they'll have a spiritual worker that will walk that journey with them.
Wow.
Yeah.
That is beautiful.
But sometimes your health worker can offer spiritual support because they take time listening to you.
There are very few doctors. Very few.
Yeah, but with
They are numbered.
with palliative care, there is a slogan by Hippocrates, you know, from the, I think it's 1500s or 1600s, that it's better to know the person that has the disease than the disease that the person has.
Wow.
So if you're a nurse or a doctor, it's important to focus on this person and learn about their disease instead of just focusing on the disease that they have. Yeah.
Wow. Thank you so much, Lisa. I'll go now to Madame Zalwangu. What process do we go through to get palliative care? There are people who need special or personalized palliative care. Mitendera kije bayina okugoberera.
Okay.
Tukunonya ku email, ku WhatsApp.
So for someone to get palliative care, I'll start with English and I can also do for the Luganda version. So we know that in our country, according to the report that we had in 2017, the Lassen Commission report says only 11% of those that need palliative care access it. And then of those, it's provided in only 4.8% in our country. So which is very small. But presently, the Palliative Care Association of Uganda, one of our focus areas is capacity building. Okay. So we see that we train health workers to provide this service. Like you mentioned, there are very few people who provide the service. This leads us to where you're asking, where do we find the service? How do we get the service? In Uganda, the service is provided in 226 accredited health facilities, and these are in 107 districts of the country. Okay. And by accreditation, I mean these are facilities that were assessed and approved to provide the services, meaning they have a trained palliative care person, they have access to medicines, but particularly oral morphine that Lisa mentioned for their severe pain and moderate pain management. They have the willingness of the management to support them. With those, we also have hospices. In Uganda, we have 13 hospices across the country that are providing palliative care services. And these do in different modalities or models of provision. For hospital, it is hospital-based palliative care services where patients will walk into hospital, they will be assessed, and once they are diagnosed, they are linked to the palliative care unit or a palliative care nurse within the facility. Then, for the hospices, they go beyond outpatient. They do home visits, whereby they go and check on the patient at home. Where the patient is weak, they are unable to come for outpatient care. These health workers go to the home, do a home assessment, assess the patients, and manage them from home. Others can be seen at outreaches, and these are through referrals and linkage. So there must be a networking. If a Dr. Lisa identifies this patient, there is a linkage to a hospice, to a palliative care unit which is close. For example, if a patient is in Jinja Regional Referral Hospital, they are linked to Rays of Hope Hospice Jinja. So they can do outreaches, and the best reason for outreaches is these people, they've gone through a moment of sickness, they are poor. So even meeting transport cost of 5,000 is a lot of money. So a hospice comes in to say, we will do our outreach at this given point where you only have to use 500 or 1,000 as transport. So they come together, they are seen, and go back. They go back home. Then the other group are those who just come by the roadside. We would want to see you, but then you're very far. So as the vehicle continues maybe to an outreach, these people come from their deep villages to the roadside, they are assessed and managed, and they go back home. So that's how they assess.
Well, we shall take a short commercial break, and we'll be back. We're talking about palliative care in cancer patients. We'll be back.
Bethany TV for Health. Introducing Bethany TV, the pioneer health and wellness channel in Uganda and Africa, having a profound commitment to health and wellness. Our content takes various forms, from music and series to documentaries, talk shows, news, features, movies, cartoons, and reality shows. We are a hybrid station available on free-to-air and pay platforms, embracing the digital age as we maintain a strong online presence through our website, social media platforms, and mobile apps. Explore our rich and diverse content, engage with us on social media, and be a part of the positive change we aim to bring to the health and wellness landscape. Bethany TV for Health. Are you ready for this good news? You can now watch Bethany TV on Your TV, Afromobile, and Airtel TV apps. Yes! Catch the finest programming prescription for everybody, wherever you are, whenever you are. Bethany TV for Health. Are you looking for a platform to advertise your business and boost your sales? Bethany TV got you covered. Take advantage of our introductory rates and maximize your leverage for brand awareness, advertising, product launching, live coverages, activations, and so much more. For booking and more information, contact our sales team on 0785 576 269. Bethany TV for Health. This is the Health Minute on Bethany TV.
Antenatal care is a care package offered to pregnant women. Here are some of the benefits of the package.
As you visit the hospital, the doctors or the health workers will be able to know if your pregnancy is at risk or not.
A birth plan is discussed, provides nutrition assessment, advice on and nutritional supplements for the mother.
Even during the antenatal care process, we are able to do scan. You're able to see the sex of your child, and we're able to determine, we're able to tell if your baby is at risk of ending into a premature baby or not.
Screening and treatment of HIV and STIs.
We are able to screen you for very many various tests, for example, like hepatitis B, malaria, HIV, sickle cell, and very many other diseases.
All these are important for a healthy pregnancy and a healthy baby.
Better healthcare for a better tomorrow. That was the Health Minute. Bethany TV for Health.
Welcome back to Bethany TV for Health. Dorothy is my name. Health and Wellness airs every Saturday from 8 p.m. till 9. Today I have two beautiful ladies. We're talking about palliative care. Palliative care. Obade tuchimanyi dozo chitegedde. Ne eyakatweyungako. Yes, you're going to be elaborating a bit more before we close the show. Madam Joyce Zalwango was explaining the process omitendera kijolira okugoberera okufuna buno obuyambi. Katagera tuddira mu lulimi Oluganda.
Neyanza nnyo kati mitendera kijoyitamu okufuna buno obuyambi oba waawe wandigenza okufuna obuyambi obwo like otya obuyambi buno buweebwa malwaliro. Amalwaliro agasoomooseddwa okukola okugaba obujjanjabi buno sinti buli ddwaliro ly'onoogendako ojja ssanga nga gye buli. Wano mu Uganda amalwaliro 226 gasobola okuwa obujjanjabi buno era nga gasangibwa mu district 107. Ng'oku malwaliro ako tugattako ne ze twandiise hospices. Mu Uganda tulina hospices 13. Tulina hospice, mobile hospice Mbarara, tulina Rays of Hope Hospice Jinja, tulina Joy Hospice Mbale, tulina Neliha Inarua. So hospice ezo ziyambako nti omulwadde bwe baba mulabidde mu ddwaliro ate ne bamuleka agende ewaka omusawo ono abasawo bano okuva mu hospice n'amalwaliro agamu bagenda mu maaso okutwala obujjanjabi mu maka g'abalwadde bano gye babeera okusobola obbajjanjaba. Oluusi bakozesa kye twandiise outreach oba ensiisira ze bakola mu byalo ebyenjawulo okusobola okusembeza obujjanjabi buno okumpi n'abantu olw'ensonga nti tufuna obuzibu mu by'entambula ne bagezaako okubayamba. Ate waliwo be balabira ku kkubo nga kitegeeza abadde asula wala nnyo ne bagamba katusisinkane ffenna olugendo tulugabane nsobole okuwa eddagala lye ery'obulumi, nsobole okuwa eddagala lye erikuyamba mu kino olw'okuba nti ebintu biba byanjawulo. Abantu bano bakwatagana n'abasawo oba famire zikwatagana n'abasawo ne balaba engeri abalwadde bwe bajjanjabibwa ne bayambibwa.
Okay. What are the options of delivering palliative care? Because tulaba abamu baagala kubeera waka, abamu inpatient and outpatient. Madam Lisa, you can elaborate more.
Yeah, so I will first stress that most of these patients are at home.
Wow.
So I know sometimes we've often said, oh, there are patients that are lying on the floors in hospital.
In hospitals, yes.
But I tell you that the number of patients that are at home and undiagnosed are so many.
Yes.
And of course there is research that has proved that home is the best place where a person can be cared for when they have this problem. So home care is the best option, but however we acknowledge and realize that a person or a patient needs to be in hospital when they need to be looked after there. But when you have a serious illness, you will not cure in hospital. So home is the best place. You are in the comfort of your living room or bedroom. You're surrounded by people that love you the most.
Very true.
So palliative care can be provided in a home setting. The health or multidisciplinary team can come and give you the service there. However, this palliative care can also be offered in hospital at the bedside. It can be offered to you as an outpatient if you're coming to get your medicine refills and you need to go back home. It can be offered to you at a communal place, at an outreach, if there are several other people with your similar problem that need to get care.
Okay.
Yeah. But the best place for someone to be when they have this problem is be at home. But if you have a problem that necessitates you to be in hospital, run to hospital, get your treatment, get that medicine that will stop the problem or alleviate it, then go home and continue the recovery process.
Wow.
Yes.
That's beautiful. We are talking about cancer patients. I believe I myself, I think I know like two cancer hospitals. One is Molago, another one, I don't know. But there's one. But you could share with us how many are there in the country? Where can one find, I wouldn't say good, but where can one get the right treatment for cancer, so that people don't run to pharmacies and buy Panadol, I don't know, herbals. Google now, we get medication through Google. So I don't know, you could elaborate more, Madam Lisa.
Yes. So thank you for that question. Just to emphasize and highlight that we are in an era of a lot of internet and there is a lot of information there, but the best place to get your right information and support is from the person that sees you and has understood your problem. Okay. So we can ask Dr. Google, but it's good to also tell your doctor that, you see, doctor, I'm having this problem. I read about it in this book, or it said this, but what would you advise?
Recommend.
Or recommend. Yes. So at the Palliative Care Association of Uganda, we have a good working relationship with the Uganda Cancer Institute.
Yes.
And it is a center of excellence, not to blow their trumpet, but it's a center of excellence in East Africa. Yes. And they have regional cancer centers in Gulu, in Ibarara, in Arua, in Ibale. So I believe that they took these places closer to the people to ensure that people come in to get diagnosed. So currently their statistics or numbers tell us that I think up to 70 or 80% of the patients report late. So if you report with stage 3 or advanced disease, even the options are limited. But however, as Joyce has mentioned, for us we have our regional palliative care centers in 117 districts. Yes. So at least there is a trained person at a government facility or sometimes a private not-for-profit facility that will listen to you and make an appropriate referral to a place where they think you can get the right care and information. Yes.
Wow, that's amazing. Well, I'll go to Madam Zalwango Joyce. Walo active treatment and exclusive treatment. Exclusive yabe sente, active yeriete. Twaga tubitegere bulungi. Kwanga, I believe there are different treatments that each and every individual receives, depending on how badly they are.
Okay, so treatment is active treatment, the exclusive treatment. Simanyi wenyinza zawula naye obujjanjabi bwa cancer businziira bwoze nga Lisa bwagambye nti kansa z'abaana ezisinga bwe ziba zizuuliddwa mu budde ziwona, naye bwe ziba tezizuuliddwa mu budde tezisobola. Tulina kansa w'omumwa gwa nnabaana, singa aba azuuliddwa mu budde awona, naye bw'ojja nga akuze kitegeeza tasobola kukola ki kuwona. Kati obujjanjabi buno nabwo buweebwa ng'omuntu bw'asangiddwa mu kunoonyereza ku ndwadde eno gy'afunye okugeza nti oli alina kansa w'ebbeere bw'ajja nga kansa abadde tannaba kukula kutambula basobola okugaa nti tusaleko ebbeere era tubayina babaddewo emyaka n'emyaka nga mulamu naye ate osobola okujja nga kansa mukulu nga ne bwe tusalako ebbeere togenda kukola ki kufuna kubeerawo banga liwera nti ng'oli bulungi kati obujjanjabi si bungi bwa ssente tulina n'eddagala erimu nga gavumenti yaffe eya Uganda ku UCI erisasula ne bakugamba eritaliiwo n'okola ki n'oligula so obujjanjabi bwe kansa businziira kansa kika ki gw'oyina ali ku ddaala ki n'ebirala ebiyinza okugenderako so obujjanjabi bujja kuba bwa njawulo era bwa mitendera okusinziira ku ndwadde oba kansa nga bwazuuliddwa.
Kituufu. Thank you so much. Well, if you're still watching Bethany TV, we are discussing about palliative care in cancer patients. I believe there are people who are out there and they wonder, how do they start? What is the role of palliative care? Families to make decisions.
Yeah.
I want, I think, Madam Joyce, what is the role of a family, to ensure that they have palliative care for their patients?
So the role of family, the role of palliative care in the management of this patient, I'll first mention that palliative care, by the way, includes prevention because we are amplifying our voices to say, please screen. Women, go and screen for breast cancer. Go and screen for cervical cancer. The men, 45 and above, go and screen for prostate cancer. So palliative care includes prevention, but also at the time that you're diagnosed, still a lot has to be done. So the role of palliative care is to ensure, like Lisa mentioned, improved quality of life of the patient and their families. Okay. But in this, we really want to ensure, number one, pain is controlled. And when we say pain, we look at the holistic approach to pain control. We look at like the dimensions, we mentioned them, the physical, spiritual, psychosocial, and the psychological, the social sections to ensure that there is no pain. I'll give an example of one of the patients that we managed, and they had cancer of the prostate. So all along we thought the pain is because of the disease.
Yes.
So every time you would change the medication, you would increase the doses until the team had to sit down and say, where is the problem? And his problem was the wife, who dresses smartly and goes away, so he's not sure if he has got another man or not. So that's where the pain is. So the main goal is ensure pain is controlled, ensure the patient is comfortable, ensure the family is addressed.
Yes.
There is something you mentioned about decision making.
Exactly.
This is a typical dilemma where the family says, don't tell our dad his condition. And
others who are saying,
others say he should know. He should know so that he plans better.
Yes.
And we've seen scenarios where the patient whispers and says, do you know, actually, I know my problem.
Wow.
But they don't know that I know. So there are always those dilemmas. There are dilemmas about treatment. We go to hospital, we don't go to the hospital. The patient says, I want to be home. The family says we want to be in this very big hospital for this aggressive treatment. We know things can get better. So the palliative care team plays a very big role, one, in what we call breaking bad news. So how will you break this bad news to this patient, to this family? It is something important for them to be able to contain and cope up with them. So palliative care providers are trained on that. Then the next thing is, how do you let the family and you, the team, manage the patient together?
Yes.
So that you agree on decisions. So what the palliative care team does, they give you the information, you make that decision.
Okay.
So they don't make for you a decision. They make family meetings so that they meet the family, they meet the patient. Together we agree on what is best for the patient. So it's not where sometimes where a doctor will just say and say, oh, Joyce, take this, do this. It's not a command instruction. we do it with family. So we call it patient family-centered care.
Okay.
Yes.
Wow. I've been in those meetings and you never want to be there.
Oh yeah.
Yeah, but you're very strong. Speaking of now palliative care, one, I wanted to discuss two things with you before we end this show. Palliative care, you mentioned about mental health as well, one of the diseases or major disorders that usually you tackle a lot. In schools, we have seen this happening. In universities, are there outreaches that are made in schools and universities, or it's mainly hospital where you focus?
Okay, so to respond to that, I will explain it using the current World Health Organization conceptual framework.
Okay.
So World Health Organization is even telling all the countries that it's not just healthcare, it's not just for the hospital and health workers, it's everyone's business. And they explain it in form of a house.
Okay.
And for someone to have a house, you will need a foundation.
Very true.
So the first building block on the foundation is the community. Communities must be knowledgeable and empowered. The communities should know about this care and demand the service.
But LOC.
Exactly, but also these patients live in the communities. We said it's the role of the family, but the community has a big role to play.
Stigma.
There is stigma, there's discrimination, but they also need information. Everyone has a solution. You know, there's this charger, there's this hub, there's this patient that had a similar problem. You want to harmonize and come up with a helpful solution or goal that will help this patient. So even if you are a health worker, if the family and community don't believe in what you're saying, then they will not take it. So it's good to share information up to the community level. And you've talked about schools and mental health that is in schools. As palliative care, we are very happy. This year we launched a school compassionate community program.
Wow.
And we launched it during the World Hospice and Palliative Care Day on the 14th of October. And we've started this compassionate community at Taiba International School.
Now,
this is a pilot. It is the first time this has been done for palliative care in Uganda. So these children are taught how to offer compassionate care or acts of kindness to people that need them, not to just their colleagues.
Okay.
So trust me, those children can cause change.
True.
And continue passing on. So we want to teach the young people, and this compassionate care in schools has been tried in other places like in India, and the students have done amazing work in terms of resource mobilization, but also creating awareness. So we are also in schools, and we hope we can expand to other schools in Uganda. That's really our dream. And another building block is, research. So we have limited research in this country, especially on palliative care. So we want to build more evidence. We want to have numbers and facts. So we are now able to collect as much information, through the health management information system. But also there are other institutions and our partners that have done quite some work that has contributed to the different decisions and policies that have come up in this country. And of course there are other building blocks that we've talked about, education and training, that people need to be trained, especially the specialist people, the nurses, the doctors and social workers. So those get a special extra training in this country. We are giving certificates, diplomas, degrees, and up to master's level in palliative care. And these are offered at, Maldme, Uganda. They have a pediatric palliative care course, an advanced diploma at Blago School of Nursing and Midwifery. We have Hospice Africa Uganda that's affiliated with Makerere University. So there is credible, institutions you can come and learn more about this. There is access to medicines. We're working close with the government. For us, we advocate. We make the noise. We bring the reasons and facts facts of why this care is important and why medicines need to be important, why we need policies that can inform decisions and ensure. So I've not finished everything, but at least ensuring that the community embraces this care, is aware, and that, you know, the schools and other young people know. But we also continue to preach this message. For example, we are happy to be on this show. You know, people are listening in, people are learning. People will make that call and say, I have this patient, where can I go?
Very true.
Yes.
That's why we shall go. Where can we go? Madam Azalwango. It's a dini, spiritual. We need to elaborate more. And before that, what are those challenges you faced in this palliative care? Apart from hiding, I know that I'm sick. Or what challenges have you faced? Because I believe there are challenges in every, you know, dilemma, anything that we do in this particular life. Yeah,
there are challenges. So the challenges are numerous, I would say. But one is, like we mentioned about communities, is information gap. Like Lisa mentioned, that communities need to be aware of the service so that they demand for it. We still have a gap of giving out this information to
right information, because
the right information that goes to the public is very important. But also, as we give out information, like you said, you're in Taiba, who is coming down here at Standard High, who is coming, so we are here, but who is going to Bududa, to that woman down there, for them to know in Chanamukaka that palliative care is this. I'm so happy with this show that we can use both languages. So it's really very important passing on the information, which is a challenge that not everyone has known about palliative care. The myths around palliative care is another one. Instead of people being referred early and at the right time, they say palliative care is death. No, don't take my patient to palliative care. We've had and seen patients die in agony when their pain is not managed, just because of the different myths people have around medications used, around palliative care, thinking if you take your patient to be diagnosed, that's when you will have the disease spread, especially when they say, oh, we think there is a lesion of cancer. Let's do a biopsy. Then people will start, so information, the right information to the public is still a challenge. Budget allocation for palliative care services in the country, if we are only in 226 health facilities, that is a very small number for the country like Uganda, meaning we still need more scale up of these services in the country, but also more human resource. So that calls for training, that calls for allocation in the public sector, public services, so a lot of that is required.
Briefly, the spiritual world. Bishops, pastors, how do you do that
spirituality in palliative care? Ebyenzikiriza n'omwoyo mu palliative care tetutunuulira ddiini, tutunuulira omuntu nga bw'oli. Bwe mba ndi mukatuliki, era mu bukatuliki bwo mwe tukuyambira. Bw'oba oli musiraamu, era tukolagana ne basheik. Bw'oba oli mukristaayo, bw'oba oli mulokole, era tetugamba nti si kirungi gwe kujja kugamba omulwadde kyuka. Omulwadde munzikiriza ye jakkiririzaamu, muyambe okutegeera ekyo kye yakkiriza. Ebiseera ebisinga kye tuyita relation with the supernatural. Ekyo kyakkiririzaamu mwe tumuogerera naye ne tumuyamba naye nga tetumukyusiza.
We have 2 minutes to end the show. Last remarks, Madam Lisa.
Last remarks. I was still enjoying being here.
We shall have part 2.
We shall have part 2. But I want to tell Ugandans that only, I think literature says about 10 or 20% people die from accidents. Majority of the people get a very long-term illness. meaning they'll be sick for a very long time before they pass.
Yes.
Let us not look at long-term illness as something strange or something that we don't know about. Let us not demonize people that are sick, but let us make sure that they get a good quality of life, that their families understand, that they are comfortable, and let's have a pain-free Uganda.
Thank you.
Freedom from pain is a human right. So if I were unwell, I would want to make sure that my pain is well controlled and all my issues are in order.
Wow.
So let's ensure that every person in Uganda that has any form of serious health-related suffering gets freedom from pain and problems, and their people understand what is happening and make a good plan.
All right.
Yeah.
Madam Joyce, a microsecond.
I'll just say thank you so much for hosting us, the Palliative Care Association of Uganda. If you let me know, if you allow me, I'll just give the toll-free line so that people can reach out to us. It is 0800-399-100. You can please call and ask more about palliative care, where to find the services, because our vision is palliative care for all in Uganda.
So what to do them in number?
The toll-free line is 0800-399-100. 0800-399-100.
Well, thank you so much. Thank you so much, Lisa, for coming. Thank you so much, Joyce Zalwango. Is it? For coming.
Thank you.
Well, thank you so much for having, joined me from the hour of 8 till 9 p.m. Thank you so much for being part of the show, and thank you for loving Bethany TV for health. Well, I would like to sign out. Have a beautiful, beautiful night, but tomorrow is the Sunday. Make sure we go to church and worship the living God. For now, we are out.